Okay, the first couple of stations, they would be about medicine. What does that mean? It's mostly diagnosis. So it's pretty much like a consultation where you have a patient that has a complaint, that you need to find a diagnosis, that you need to investigate, and you need to manage. Most of the time, you don't have to actually do an examination, and you have to verbalize the examination you're going to do or verbalize the investigation you want, and you will be handed them over. You need to be careful here because I know this seems easy, but you don't have much time and it could be tricky. Let me give you an example. We'll start with tiredness. The first station of tiredness, as I remember when I was prepping, was a patient who, that's from the book I was prepping from. It was a blood result for a patient with iron deficiency anemia, and you have to talk to them about it. So when I was prepping for this station, I used to ask a million questions that was irrelevant. I'm just following a scheme to the point where I'm so structured. But if you think about it, you already have the diagnosis. You have the blood result. The patient is coming for a blood result. You've already had a chat with the patient before and you have the information needed. Now you have the blood result that shows iron deficiency anemia. Are you going to ask about anything else? You want all of your questions to be targeted to iron deficiency anemia. For example, if the patient is a young female, you want to ask about menorrhagia. If your patient is an elderly man or woman, you want to ask about signs and symptoms of cancer, or perhaps signs and symptoms of bowel cancer, even more important. If your patient is a man like me, who probably has a sore shoulder from the gym, you want to ask if they're taking any ibuprofen chronically without any stomach protection. You see? So here you don't have to dive into the exploration of the chief complaint. You have the diagnosis. You don't have to think about it. All you have to do is find risk factors for the diagnosis so you can have something to base it on. When you tell the patient, okay, so I have here the result of your blood test, it shows iron deficiency anemia, the patient is going to ask you what is the reason for it. So you need to have already asked for all the reason you know for iron deficiency anemia, rather than asking, do you have any pain? That's not really going to be effective. Let's say the patient has palpitation because of the anemia. Okay, I get it. But it's not really crucial because remember, you only have 4 minutes for the history taking. So be clever, be sufficient.